94.3 WYBC, the rhythm of the city. I'm Darryl Huckaby along with Dee Dee in the morning. And today we have a special guest joining us to talk about a topic that is pertinent to a lot of people, a lot of our listeners, and it has to do with affordable health care. So I'm excited to introduce to you James Michel. He is the Chief Executive Officer for Access Health CT. Good morning, James. How are you?
I'm doing well. Good morning, and thank you for having me on this morning.
Oh, definitely glad to have you on. And we're at a time where time is running out, so to speak, with open enrollment ending on January 31st. So let's talk about open enrollment.
Sure. Open enrollment is the time of year where Connecticut residents could come and shop and compare and enroll in health insurance plans on Access of Connecticut. And also, they could renew their plans as well. So every year, you have a chance to come in and change plans, pick a different plan, or if you don't have health insurance, you could come in at that point, enroll, shop, and compare and pick a plan for you and your family. They can also sign up for dental as well. Dental as well. The open enrollment period began on November 1st. This is every year. It typically ends in December 15th. But this year we went to January 15th and further extended to January 31st. As you know, the governor created a subsidy for some folks who lost some of the coverage affordability because of the lack of action on Congress and the president's side, because they let a bill pass and it expired. So some folks lost some subsidy they got from the federal government. So the governor back in mid-December introduced a state subsidy. That state subsidy is going to allow some folks to help some folks make the health insurance more affordable. So because of that, we'd extended the open enrollment to January 31st to give those folks an opportunity to come in, shop, compare, and enroll. Because some folks, they were just waiting to see what happened from the Fed. Since they didn't do anything, the governor introduced his bill, his subsidy. So now we got to give them more time so they could come in, pick a plan that's affordable for them and their families.
Now, January 31st is an important date. You have to do it or shop and pick a plan by then, because if you don't, then you have to wait.
Yeah, what happens then, the open enrollment closes on the 31st. You will not be able to to do it until next November 1st. So that's a whole year without health insurance. Imagine, hopefully, you and your family are healthy, but things happen throughout the year. You get sick, you go to the hospital, you have a broken leg, something happens to you, and it is extraordinarily expensive to have health care provided to you without health insurance. If you have to come out of pocket, it could be thousands and thousands of dollars that you and your family may not have, or if you have it saved for future use, it could be gone.
And I read somewhere a statistic where most bankruptcies are a result of medical expenses that people can't afford.
That is absolutely still true. The biggest reason for personal bankruptcies is personal health debt. Meaning people will go to the hospital, they had some service done, they didn't have health insurance, so now they cannot afford to pay it. The hospitals go after them, so they have to file for bankruptcy to protect their other assets. Biggest reason why people file for bankruptcy and still in the U.S. is medical health debt.
Yeah, we want to make sure that our listeners stay healthy.
Again, it's easy to do. Just go to accesshealthct.com, do the application, and then you can enroll, pick a plan. And we have brokers. We have brokers free that will help you pick the best plan for you and your family. Again, it will be affordable. If you qualify, the subsidy is still available for you and your family for you to pick the best plan for you and your family. And sometimes health insurance could be very confusing, complicated. So we have certified brokers and that we have certified. They're licensed, certified by us, where then they will help you pick the best plan for you and your family that's affordable for you. Now, if you go to our website, accesshealthct.com, we have a page called Get Help. So click on that page, and you could put your zip code in. It will give you brokers that are within your zip code. Hopefully, someone that looks like you and connect with you culturally.
Yep.
because we have put some focus in that space over the last 4 or 5 years.
Nice.
To have more Black and brown brokers available for the communities of color. So again, they'll be able to connect with you and talk with you and help you pick the best plan for you and your family that's affordable for you.
And again, if you're just joining us, we're talking to James Michel. He is the Chief Executive Officer for Access Health CT. And we'll end on this final note. I can speak from personal experience. For the last couple of years, I've been through the portal of Access Health CT to get my insurance, both health and dental. And I can't say that it definitely, through the subsidies, have saved me a tremendous amount on my monthly health insurance costs, as well as the ease of using one of your brokers to kind of navigate me, because health insurance, like you said, can be confusing for most people. Right. And your brokers are well educated to, really put it in layman's terms so that, we as, community members can understand it and, make an educated decision.
Absolutely. Again, I cannot overstate how important it is that everyone should have health insurance.
Absolutely.
Yeah, because God forbid, you get sick, somebody in your family gets sick, your kid gets sick, you need to have health insurance to make sure your health is covered. More important, but also you're financially covered. But more importantly, all the plans that are on the exchange provide certain coverage free of charge to you. Meaning that when you go to the doctor, you have no copay, no out-of-pocket costs, and that is your preventative type of services, such as your annual physical, colonoscopies, mammograms. So certain preventative medical procedures at no cost to you when you show up at your doctor's office.
And I'll end on this note, because last year, and I shared this with my audience before, I was diagnosed with prostate cancer and had to go through a whole series of tests and biopsies and eventually having surgery. And I can tell you, without health insurance, the cost for that would have been astronomical, which would have put me in one of the categories of filing for bankruptcy. Yeah. So again, we urge you to make sure that you get your coverage for yourself and your family and people you have it January 31st to make your decision. And the website is accesshealthct.com.
And also, the thing is also, the brokers will be there to help you at no cost to you. And I want to be clear about this. If you sign up between now and January 31st, the date of your insurance kicks in on February 1st.
Okay.
If you miss that deadline, you got to wait until the next year's open enrollment, which is a whole year without any health insurance coverage. You start gambling with your health and your finances.
And you definitely don't want to do that.
We'll do that. No.
James Michel, thank you for joining us, Chief Executive Officer, Access Health CT. We appreciate what you do in providing this service for the community.
Thank you much. Appreciate it, sir.
All right. Good day. I'm Darryl Huckaby, along with Didi in the morning on the Rhythm of the City, 94.3 WYBC.